Good afternoon, everyone that is with us in person as well. Those of you that are joining us via Zoom, thank you so much for your time and commitment. We're excited to be here and to be able to have this conversation, and excited to have the First Lady with us as well. But to kick us off and to share the purpose of today's roundtable, I'm going to turn it over to Cathy Jenkins to start us off. Thank you.
Thank you. Well, Travis, thank you. I'm going to actually give most of my time to the First Lady, but for those of you who I haven't gotten to meet, I'm Cathy Jenkins. Last time I was in Abingdon, I was Chidi Uche, and I didn't have a baby yet, so things have changed in 18 months. But it is really good to be back, and if they leave us, we're glad to stay, honestly.
Okay. We're not leaving you behind.
So we are just so glad to be here with the Trauma-Informed Community Networks. As you all know, I serve as advisor on childhood trauma and resiliency, and I know many of your networks because I've had the opportunity to join your meetings, if not in person, virtually, and be able to travel the state and meet and know a little bit more about all of the work you do to serve your communities. And we just felt very strongly that we would have been remiss to take this resilience tour and not sit down with all of the different networks around the state. So it is a pleasure to be here with you all, and we just hope that you will continue to share and elevate and uplift anything that it is that you feel we should know about, especially coming from Richmond, and especially as we plan to transition here soon, so that you can continue to not only sustain your work, but ensure that those who are in Richmond know about everything that you are doing, and they can continue to support you in whatever needs and ways that they can. So I will turn it over to the First Lady, and looking forward to the conversation. Thank you to those who joined online.
Boy, that's a heavy microphone. That thing's not going anywhere. Well, hello, and thank you all so much for having me here today in beautiful Abingdon in the fall. Oh my goodness, flying in here today, all the colors were just gorgeous. I was trying hard not to be sick, but it was so beautiful that it wasn't that hard to do. As Chidi said, I just want to echo her and say what a delight it is to get to meet you all in person and think about all the incredible work that you do on a daily basis, but also to listen. And we just had this tremendous speaker here and who was talking about the importance of listening and truly hearing. And so we look forward to really listening to you all today and hearing your wonderful stories. As Chidi just mentioned, I am also the chair of the Children's Cabinet here in the Commonwealth, which is made up of the departments which most often touch the lives of our children. That's Health and Human Resources, our Secretary of Health and Human Resources, Secretary of Education, Secretary of Agriculture, and the Secretary of Public Safety. And they've done so much work these last few years to address food insecurity, early childhood care and education, and of course, school safety and trauma-informed care, which so many of us deal with in this room today. We're just so thrilled to have been a part of today's Rural Resilience Summit. And I had to practice saying that a few times. It's not so easy to get out. And it's a wonderful way, these kinds of opportunities for us to care for each other, which sometimes we put on the back burner when we do these kinds of activities on a daily basis. But we know we need to take care of each other and ourselves sometimes, and to increase public awareness of the incredible work that you do, and to take part in continuing education for our rural communities who continue to lead the work of resilience building throughout the Commonwealth. So we so appreciate you all setting the bar high. I'm so fortunate to have the opportunity to travel the state on this resilience tour to speak about the importance of this work. And I get to travel sometimes with our secretaries who sit on the Children's Cabinet, and I'm so excited today because we're joined by many special people, but someone very near and dear to my heart, and that's Gina Berger, Chief Deputy Commissioner at Virginia Department of Social Services. Give a wave over there, Gina. Yay. Gina, like me, is a native of another rural area. She hails from Eastern Kentucky and knows well the challenges that rural communities face. And so I'm elated that she's here on behalf of not only Secretary Dan Carey, but also Commissioner Storr. And so she wears many, many hats. So thank you for joining us today. And of course, Chidi, whom you've met, and Rachel Becker as well. And my own Chief of Staff, as well as Assistant Secretary of Education. What's your name again? David Carey. Poor David, he doesn't get paid enough for this job. This legacy tour, really to speak about your legacies and the tremendous work that you do for our children, has been an opportunity for the Children's Cabinet to highlight the many individuals, communities, and agencies and organizations who come together to support our children, youth, and families in so many ways over the past several years, and especially throughout this very difficult time in the pandemic. We've already had the opportunity to visit several sites to see the work that's being done. Over the past 3 years, I've visited schools with amazing social and emotional learning programs, sat down with home visitors and incredible families with whom they work. We've had a powerful conversation with a group of high schoolers for a youth conversation last week, and here we are today, close to wrapping up our tour, I think here at the end of October at the Rural Resilience Summit, certainly saving the best for last, don't you think? And with this fourth and final community conversation with the TICNs of Southwest Virginia. I'm looking forward to hearing about the amazing work you've done to respond to trauma and build resilience in your respective communities. But also, as Chidi mentioned, we would like to know what we can do to make your jobs better. As you know, we're preparing to bring in a new administration every 4 years in Virginia without fail. And what we learn on this tour will help us to inform the governor's outgoing legislative budget and legislation priorities. It will allow us to better brief and prepare the leaders of the next Children's Cabinet on where they should focus their efforts moving forward. So before I hand it off to get the conversation started, I thought I might offer Gina a chance to have a few words as well. Gina, you want to say a few words?
Good afternoon, everyone, and thanks to the First Lady for including me on this visit. Southwest Virginia is always near and dear to my heart. I am from Kentucky, grew up in central Kentucky and have lots of family in eastern Kentucky still there. So a lot of the issues that you face in Southwest Virginia are issues that I actually faced growing up. So it's always a real honor to be in Southwest Virginia for an occasion like this. And I will say that at the beginning of the administration, I think a lot of the staff, particularly the staff that were staffing the Children's Cabinet, as we were sort of thinking about the priorities of the administration and what the priorities of the Children's Cabinet would be, it was very apparent that we had an amazing opportunity with a governor who's a pediatric neurologist who understands the brain science around childhood trauma and resiliency, and who had a First Lady who was going to be very supportive as a teacher in the early childhood space, but also in so many other realms. And so it's been an incredible opportunity to work with local communities around the issue of resiliency, particularly in both the early childhood, but also the maternal health space. Many of us on this team were here in 2019 when we did our maternal health listening tour. Also, we heard a lot and really were able to formulate a lot of great budget and legislative changes in the past 2 years because of what we heard on that tour. I mean, it's one thing to sit in Richmond and you can look at the data, and the data is very powerful around all of these things. But what really informed a lot of our policies has been opportunities like this to sit with people in communities, to understand what the barriers are to service delivery, and to take that back and try to formulate it in the form of legislation and budget. So really looking forward to the conversation today as we go into the next budget cycle.
Thank you.
Everybody who is attending today, either in person or online, welcome. My name is Melissa McGinn. I serve as the state coordinator for Virginia's trauma-informed community networks. These are multi-sector, community-led collaboratives, started back in 2012 with the first one in Greater Richmond, and have now spread across the state. There's 27 in regions all over the state. Southwest Virginia TICN is our largest network, or at least has the largest geographical area that they serve. So we have been on this listening tour for the last 3-4 weeks. Want to welcome everybody to hear from 3 of the trauma-informed community networks from this region. Today we're going to hear from Southwest Virginia Trauma-Informed Community Network, the New River Valley Resiliency Network, and the Roanoke Valley TICN. We have several questions that we're going to be asking the participants. I'm going to start with our host, the Southwest Virginia Trauma-Informed Community Network. If you could briefly introduce yourselves and share an example of your network's impact that helped to promote resilience during the pandemic.
Good afternoon, everybody. I'm Danielle Dye. I'm the Community Resilience Manager at United Way of Southwest Virginia, and I do oversee the Southwest Virginia Trauma-Informed Community Network. So over the last year, we've been very fortunate to see a lot of growth with our trauma network. We were very fortunate to receive FACT funding that helps support a position, and having that person in place to build capacity allowed us to support our work. So as far as what we have done, we've expanded our network from an original 12-member network to now 92 members.
Wow.
So we are, I think that just shows our region's resilience, because we are dedicated to this work. We want to make this region a better place to live, work, and raise a family. And we realize that single-handedly, we are not able to do that. We have to work in a collaborative fashion. So in order to do that, we have to combine our resources and expand our work to be stronger together. And that was very much the case as we developed a COVID-19 resource guide that we were also able to share out with our community partners, our school systems, children, families, and others in our region. So we've continued to collaborate on training opportunities together. We utilize our partners to help us grow and expand, and also reach out even across state lines as well, to tie our work in with those of our other partners. And I don't want to steal their thunder, so I won't speak for them, but our region's ability to kind of drive resilience comes from our nature to just make this place a better place to live and work. So,
Danielle, could you tell us a little bit about what community partners have joined and like who's represented in your different? Sorry to butt in here.
no. So with us today, we have, I'm just gonna go around the table. Melissa Roberts, she is the Executive Director of Bristol's Promise and oversees Bristol's trauma network that covers both Bristol, Tennessee, and Virginia, but she focuses on workforce development. And again, I don't want to steal her thunder, so I'll let her talk a little bit about their work. And then we have Jenny McLeod. She is the trauma-informed administrator with Ballad Health. And Ballad Health was a huge supporter of our work and helped us with match funding, as well as offering training opportunities to continue to help us build our toolkits and help the network grow as well. And then we have Dr. Susan Patrick, who oversees our Childhood Success Department within United Way, and then Dr. Dennis Carter, the original Southwest Virginia Trauma Network leader. And so, and then we have Travis Staten, our CEO, our fearless.
Great, thank you.
Do I pitch it?
Was there anyone else from your network that would like to speak to the first question around resilience?
If there's ever an opportunity to speak, I always jump, so thank you. Again, I'm Dennis Carter, Superintendent of Smith County Schools. Yeah, so lots of things bubbled to the top as far as concerns that we had as a region, and it became very evident very quickly once schools closed in March of 20 that we had to rally and support our folks. And it really was a community taking care of others. And if you look at the concerns that we realized, one was nutrition, right? Providing food for our youngsters. So we reestablished our transportation program to be a food delivery program. And that happened over the course of a weekend. That was a quick resolve. And that's not Smith County, that's Southwest. I'm fortunate enough to set up here as a representative of superintendents, but that's all of Southwest that rallied to that charge. The other piece that we saw was we had some children living in very difficult situations. So the home visits, lots of phone calls. And really the question that was asked was, are you okay? How can we support you? And we quickly realized that a support system for crisis, for mental health concerns needed to be established. So when you talk about multi-sector approaches and really the focus of a community pulling together, working with Mount Rogers Community Services Board, establishing a crisis hotline for students and for parents and families, and getting that message out was vitally important to protecting our kids and our community as we move forward. Again, behavioral health services, all the educational piece, and you'll notice I mentioned education last, and really in the time of the pandemic, at the beginning, education was last. It was taking care of our folks and making sure that people were safe first, and then addressing the educational needs. And you don't hear a superintendent say that much. So, but that was our focus. Again, quickly, we in Smith County, we experienced, we were third in a community health needs assessment through our local hospital. This was 3 years ago or so. We realized that Smith County was third in NAS score. So that's a statistic you do not want to be attached to. And conversely, on the other end of the spectrum, our regional jail cost soared from 2010, $675,000 to $2.9 million in 2019. And when we're putting that much toward incarceration and not toward education, we have a fundamental problem that we need to delve into the root cause. So that was the basis of our examination and looking at the ACEs and how can we address that as a community.
Melissa, would it be okay if I ask a follow-up question? And I apologize if this is like on your next list of questions, because I don't know what those are. But I'd be really interested to hear. So I know there's been a lot of focus on the trauma-informed service delivery, but one of the things I think, has been clear, especially through our local departments of social services and others, and possibly this might be a question for you, Jenny, too, focusing on our healthcare workers and our workforce that are delivering these services, and maybe what you all have done in building them up and building their resilience, because we know that all of these are frontline workers, whether they're healthcare workers, whether they're home visitors right now, whether there are local departments of social services. Child Protective Services was still out there on the front lines investigating child abuse and neglect. And so I'm just curious if there's things that you all did as a network to sort of help support resiliency in your workforce and your workplace, because that is, we are just increasingly worried about the burnout and the trauma, and the secondary trauma that a lot of our workforce is facing and from COVID.
Yeah, so I have the privilege of being the trauma-informed administrator for Ballad Health, which is, it's rare to have a hospital system with that position. And I'm under the population health umbrella. I actually started in January, so it's interesting to start a job in the middle of a pandemic.
Wow. Baptism by fire.
And I completely agree. I've done some volunteering in some of our facilities, and I think where our healthcare workers are right now is on autopilot. And when things slow down and they can catch their breath, that's when we're going to have a lot of things surface. Right now, they're just get the job done and take care of everyone, and they're not taking care of themselves. So our EAP program has worked really hard to put that out there, but there's still such a stigma on mental health that some of our people are not accessing those services. As far as the Trauma-Informed Care Network of Southwest Virginia, I've worked closely with Danielle. We're working on some toolkits and looking at trauma-informed care in a healthcare setting is very different. I came from being a school counselor for 12 years, so that's where my trauma-informed care work started. So I think right now we just need to support our healthcare workers to get through what they're doing. They've made it work. So when I came to volunteer, they were just like, well, we've got it. We just take turns answering the phone. And I'm like, well, I'll free you up for that, but it's just a knee-jerk reaction because they figured it out. So I agree. Our social workers, our child protective service workers, they didn't get to work remotely. They were still going into the homes and taking care of the children. And we've got a lot of work to do when this dies down a bit. And the recent Delta variant surge, that was also kind of a kick in the teeth almost, because we were coming out of it and our infection rate was very low and it spiked again. So I don't know if that answers your question, but it's definitely on our radar and it's definitely a priority for sure.
I want to give some of the other networks an opportunity to share. So maybe New River Valley Resiliency Network, if you want to just share a little bit about, well, first introduce yourself, please, and share how your network just kind of showed resilience during this time.
Absolutely. I'm Andy Gillespie, and I'm the chair of the NRV Resiliency Network and the executive director of NRV Cares, which is a child abuse prevention agency. And I will say one of the beautiful things about the New River Valley is that we're a very tight-knit group and that we all want to support our community. So all agencies, all organizations have already had that. And so as 2019 was rolling, that we started realizing this is what we're doing as we knew about the state network growing, that we already kind of had the group for the trauma-informed network, so it just made sense to kind of come together. And so we started establishing our network, and then of course the pandemic hit. And as much as we recognize, wow, we're all going through trauma and how necessary a trauma-informed network is right now, we also recognize that we had really individual responsibilities of our agencies that they really needed to take care of their separate entities. And so, we were nicely written up by Charlotte as far as being an organization that actually modeled pausing and kind of doing some self-care of our network of saying, we need to take a pause, everyone kind of attend to the needs of everyone else. And of course, we continue to communicate. And we got through that. And of course, we said, we're still here, we're still doing this, but we did take a pause and then come back together and have been working to grow the network and bring in more and more folks. Because with the NRV, we are 5 counties wide. And so we want to make sure we have all voices and all folks at the table as we're continuing these efforts. And then I'm gonna pass it over to my co-chair here.
Hi there, I'm Laura Beth Weaver. I'm the Executive Director of the Women's Resource Center of the New River Valley. And we are the Commonwealth's oldest domestic violence program. And we serve the entire New River Valley as well. One of the things that I feel like really was important for us during the pandemic especially, was we sort of naturally recognized that in the New River Valley, we have for a very long time operated as a unit, as a region. And so, for example, my organization and Andy's organization and our New River Valley Community Services folks, we have many organizations that operate New River Valley wide. So all of our services are available to all of the residents in those 5 jurisdictions. And that was really positioned us well to tackle the pandemic itself, because we had all of the players at the table at all of these various meetings already. And so our local governments operate together as a unit when it comes to requests for funding and budgetary processes. They have a really cool joint budget process. So we only have to do 1 application instead of 5 separate applications. It's quite nice. But we already have this cohesive relationship as a region. And so when the pandemic started and our TICN was getting off the ground, we were all already at the tables. And so our job became, as a resiliency network, to support the work that was happening in these various places. Our local governments came together and created a public health task force, and we supported that work. And so we kept coming together And we kept supporting each other. Your question about employees, we found ways to support each other's employees, each other's frontline workers, in ways that you can't make a brochure about, but certainly translate to resilience. At one of our meetings, we were talking about strengths and weaknesses and how to support each other kind of around the table like this. And it was one of those days where when you leave the house in the morning, you see the spider webs, right? At the change of season, when all of a sudden you can see the dew on the spider webs and realize they've been there the whole year, but you just don't see them, the thousands of spider webs in the field. That's what, for us, during the pandemic, that's who we were in the community. We were the spider web, coming together, having meetings, supporting each other, pushing information out, and not reinventing the wheel. Again, it doesn't translate to a pretty brochure. Spider webs don't. But the work was sacred, and supported the resilience of our school systems and all of the other places that were doing the work, and honestly have been doing the work for decades, right? Yeah. And we have another member on the Zoom machine too.
Zoom machine.
That's you, Dee, if you wanted to add anything. You're good.
Hi, I'm sorry. I'm Dee Frith, and I'm with New River Valley Community Services. And my animals behind me have been very badly behaving today. I've been really quiet, but just really new to this, and appreciate everything ACEs and trauma informed.
Well, welcome. We're glad
Thanks,
that you
Dee.
could participate. I would also like to toss it to others that are online right now, and that's the members of the Roanoke Valley Trauma Informed Community Network. If you wouldn't mind introducing yourself and sharing a little bit about how your network was resilient. And maybe we could start with my old colleague, Cathy Brown, I see up there. Hi, Cathy.
Hi, Melissa. So good to hear your voice. And we're really excited to be here with you today. My name is Cathy Brown. I'm the Division Director for Child, Youth, and Family Services with Blue Ridge Behavioral Health Care. And we are the Community Service Board, which serves the cities of Roanoke and Salem and the counties of Roanoke, Botetourt, and Craig. And we have been involved with the Roanoke Valley Trauma Informed Community Network since its inception in late 2017. And let me pass it to my colleague, Linda Hentschel.
Hi, I am Linda Hentschel, and I am the President and CEO of Family Service of Roanoke Valley. We are a local mental health organization and have also been with our TICNs since 2019. And Lisa Denny will introduce herself.
Hi, I'm Lisa Denny. I'm the Director of Child Abuse Prevention for Children's Trust. We are the Child Abuse Prevention, Intervention, and Advocacy organization here in the Roanoke Valley and are the backbone organization for our Trauma Informed Community Network. And I'm going to pass it to our trauma specialist, Decca Knight.
Hi, everyone. I'm Decca Knight. Thank you, Lisa, for passing it to me. I have been doing trauma-informed care work for about a decade, and I am very, very lucky to be in this position to coordinate the efforts of the Roanoke Valley Trauma-Informed Community Network under Children's Trust. And I was actually in Abingdon this past weekend doing a race on the Creeper Trail, and I'm thinking, like, I should have just stayed and enjoyed everything down there. I went to Rain for dinner. It was fabulous. So I should have just stayed down there to see all of you all in person. So I want to start out by saying that the Roanoke Valley Trauma Informed Community Network is a unique kind of combination of our urban communities and also our rural communities. And so we have unique needs with all the organizations that we serve and that we support. And that we really, really appreciate the chance to be able to speak with you all today, even if it's virtually, and having the opportunity to share with the First Lady and members of the Children's Cabinet. So we have done a lot of things to promote resilience for our network in various ways during the pandemic. We were really quickly able to shift to do a lot of virtual work with different community members and other individuals in our network. And we tried to be really consistent with our members. We understood that they were doing a lot of mental health support support for their clients and for their patients, and it was important for us to support them through that process. We have something within our TICN called a learning collaborative, which is organizations that have gone through extensive training in trauma-informed care. They have done assessments, they have looked at their policies and their procedures. And Cathy, Linda, and Lisa are leaders in their organizations that were with our first Learning Collaborative. And so our Learning Collaborative was really coming together and doing that important work and training and really looking deeply at their organizations during the pandemic. And so not only were they doing a lot of learning and really doing a lot of outreach into their community, but they were also supporting each other, which I think was really important. I think that a lot of us, especially in the mental health field, were kind of, forgotten about as being the supporters during this time. And so I think it was really key for them to be able to support each other. The other interesting thing that actually happened during the pandemic is that we were able to see an uptick in the attendance at a lot of our trainings, at a lot of the TICN trainings. So we had a lot more people coming to our community trainings. We actually just had a training yesterday that was probably, I think it was our highest attended training that we've had. And it was on the intersections of attachment and trauma. And so we had organizations, all the way up to Lynchburg and Bedford who were able to join us for that training. And the other thing that we have been doing is during a lot of our trainings, we are focusing on that self-care for our members, and that's really important to us. So we always spend time at the beginning of our meetings doing some mindfulness and self-care practices. We know that most of the individuals who are on the calls with us are leaders within their organization, and so they're running from one thing to another throughout the day, and we really want them to take a moment to pause and take care of themselves so that they can take care of others. So we have really had a big impact here in the Roanoke Valley during this time, and we have grown a lot during the pandemic as well. And again, we just appreciate the opportunity to be here and speak to you all.
Great, thank you very much, Decca. I want to move to our next question. So what issues have emerged for children and families in your communities since the start of this pandemic, particularly for different populations you serve? And when thinking about what is needed moving forward, what would you want the next administration to know? And I'll go back to our friends at Southwest Virginia and TICN who would like to get us started.
So I would say some of the needs that have emerged are just what everybody has already said, the mental health needs and mental health crisis, both for children and families in our region. I don't want to be remiss and steal Dr. Carter's thunder, but I would also say too, our educators, they have their own mental health crisis in dealing with the children and students in their classrooms. So one of the things that we are working to do is create a trauma-informed schools designation. And that designation would work to help support school districts in our region to kind of get that blue ribbon star of approval, so to speak. And what that means is that they've gone through the process of, we've conducted several different assessments, taking that data and creating action plans for schools based on where their needs are. And so meeting them where they're at. We know staff self-care is going to be a huge component of that. And we want to recognize that if they are not able to take care of themselves, how do we expect them to take care of all the kids and their families? It's very much a ripple effect. So in utilizing this designation, we want to be a leader across the state and look so that other school districts can, we hope, do a similar practice of what we're trying to establish here. And we couldn't do that without already strong established partnerships and relationships with our schools and our school districts that both United Way already had in place. And so that is a component that we're going to continue to build in the next 2 years, but that was a need that did emerge, and we want to continue to address those needs as well.
Needs emerged, and I think solutions are being found. I think the need emerged that there was a realization, lots of amazing work being done by organizations, but very little work being done collaboratively. So my thanks goes to Travis and United Way for supporting this effort and being the backbone organization for this initiative. When we're looking at things that have emerged as in crisis and the situation we're in, behavioral support services are our biggest concern as we continue to navigate forward. You'll find in Southwest Virginia, based on funding, and I hate to talk money, but that's the realization of where we are now. Our dollars are used to operate schools to a point, and there's no extra money to go beyond. So if we're looking at, from a budgetary standpoint, if we truly want to make a difference in the youngsters, and you hate to look at an opportunistic side to the pandemic, but we're there. We have kids that have been in isolation for so long, and now they're back to us, and we're reintegrating in an in-person situation, and we're seeing behaviors that we have not seen before. We're seeing behaviors that our teachers are not prepared to handle. And when you go to an area that does not have the local funding capacity to go beyond, like some areas do, our funds, again, are isolated to teacher salaries and paying the bills. That's what we're tied to. So anything beyond to provide behavioral support services, we just don't have the funds to make that happen. So some consideration with General Assembly in moving forward with a mandate or an expectation, but a funded mandate, not an unfunded mandate, which we do get into sometimes with public education, as we all know. So that expectation is great, but there's a second side to this coin, and it is, are the workers available? Do we have that ability? And in Southwest, we don't have the mental health support system capacity that we need to address the needs that we have. So it is a compounding issue, but I do think it's something that can be incentivized in some capacity through scholarship funds, some type of payback if you stay in a rural area or something with college funds. But in turn, local school divisions, we have a captive audience. We have the kids, they're coming to us. So how can we support them? How can we get those services into schools? And some type of funded mandate could be a catalyst for extreme positive change.
Is there anyone else from your network that would like to respond?
So a little bit of clarification. So we hold in trust the Trauma-Informed Care Network for Northeast Tennessee, for the upper 8 counties. And that started in the pandemic. But we have a really unique program that does workforce sustainability. So we have a community resource navigator who is on site at partner businesses to provide wraparound services to workers. So Gina, further to your question, this is a pilot program that we built based on models around the country, but we're the only one that we're aware of that is focused on building resilience in our workforce, because we know that trauma's in the room with mom and dad, right? And grandma and grandpa. And so we did a lot of research and piloted that. Our first partner signed on March 3rd of 2020. We all know what came shortly after that. But the brilliant thing is that we are collecting aggregate data and sharing that with the leadership of the workforce. And so the two biggest needs that we've seen, especially in our workforce, are a lack of childcare, which United Way of Southwest Virginia is working super hard on, and also a lack of affordable housing, and especially when we saw the eviction moratorium lift. So, we were able to provide that service to Bristol, Virginia Public Schools. So we were able to provide wraparound supports for our teachers, which was exciting because, as Dennis said, that's something that our teachers really needed, especially as they were navigating new and strange times. But those were the two needs that we've seen clearly from our workforce partners, is childcare and housing needs.
Can I ask a follow-up question just real quick, Melissa? Thank you. That's very helpful. On the childcare front, is it capacity in the community, or is it affordability, or maybe a mixture of both?
Yes.
Affordability.
Short answer is yes. So, our childcare facilities oftentimes have really long waits. So they have a waiting list for people to get in, especially the childcare facilities that are subsidized. And we know that our childcare workers don't make a living wage.
That's right.
And even when it is subsidized, so it's always going to have to be a public-private partnership. And, part of that is you don't want to put your child in those formative years just anywhere. So we want to make sure that these are high-quality early childhood, points. And we also want to include parents in that because parents are the first educators of our children. So we never want to forget that parenting doesn't need to be left out of the conversation when we talk about childcare.
Right. And this might be a little bit of a leading question, but it's something that I've heard in other in other areas too, is that the capacity issue for childcare is also when it goes beyond 9 to 5 and having, for parents who need childcare who work a night shift or something like that. And that is particularly hard to find. So just want to, right? I don't know what I just want to make sure that it's like a documented thing on our, because we hear it so much, but that doesn't specifically get mentioned a lot, but in a workforce.
Absolutely. We work with a manufacturer in Bristol, Virginia, who also has a location up in Meadowview, Virginia. And speaking directly to them and their work, they have third shift. So when you get to third shift, not only do you have a lack of childcare that's available, but you also have a lack of transportation. And so that's another emerging need that we're seeing.
Yeah, I'll introduce myself. I'm David Carey. Hello, as the First Lady said. Part of my job is obviously overseeing our early childhood and childcare policy in the governor's office, but also keeping everyone on time. So I will remind us she has 8 minutes left to talk. It's just one piece there in my other hat. But the other on the childcare piece, I think that's important what you brought up. And I think that there's sort of multiple levers that need to be pulled because we have a great amount of money from the American Rescue Plan Act. The First Lady was just in the other room talking about the $488 million that is going directly to cash grants to existing providers to keep them open. And that doesn't even count the other about $700-800 million that are going into the system too for other purposes. And part of that was that expanding access to the child care subsidy program, extending that up to 85% of the state median income, which we'll be able to do for about a year or two max. But I think for us, with this question about transition, what do you think you want the next administration to know? We're in a position where we also are trying to tell whoever the next administration is what to do. And so continuing to advocate for keeping that eligibility higher, but in order to afford that, the plan that's being discussed in Congress right now from President Biden has to be passed because that extending that up to the median income is not sustainable because we have one-time ARPA dollars to do that. And so, anything, I know a lot of people have been in touch with their congressional delegation and those folks, but there's obviously partisan differences and things going on, but at the end of the day, the state is not capable of funding the level that we need. It has to be matched with some federal dollars. And so that's a big thing. And then capital expenses too. One thing we've talked about is it's not just having, extra subsidy, because as you said, either there's not a provider or it's a provider that doesn't take subsidy. And so you need a third type of money, which is capital funding to build more buildings. And it's great that there are some private folks to help with that. I know, and United Way has done great things with the business community and the early childhood community. But I think our sort of budget package we're leaving for the next governor is not out yet, but there's a chance there'll be something in there that might start to address or study what the capital need is, because that's one thing that of all the billions of dollars that have gone into childcare, none of it is legally eligible to be used for brick and mortar. You can use it to pay your teachers, you can use it to give subsidies to kids, you can use it for AC inside of your building, but none of it can build a new building. And so that's something, a sort of a third type of money, if you will, that we want to start the discussion about, and to have all of your voices, and saying to Richmond and DC, we need capital funding for childcare deserts. I mean, we talked to folks in Wise County recently that had literal employers looking at their area that said, we'd like to come to Wise, but what is the childcare situation looking like? And, Natalie told us that they had to, that there's people that they know they can't compete with because there's not a place for employees to send, with children to go to during the day. So it's a I don't need to tell you that. I guess I'm just preaching to the choir here, but
right.
I think that right. But I think the next thing is, in terms of bringing us back to the ask, is help with that sort of other people, talking about the need for capital investment for exactly what you're talking about. I think is going to be really important for this next administration in Virginia.
And before I turn it over to New River Valley, do we have a hard stop at 3? Or before that?
About 2:52.
2:50.
Yeah.
Oh, okay. I was working
to be specific.
Okay. So very quickly, New River Valley, any specific needs that have emerged that you want everyone to be aware of, and just the next administration moving forward, what would you want them to know?
So I'm going to second everything that has been said, and you can just put my name beside whatever of what you said you want to. I think for us, transportation, education systems, all of those things are things that we've all known for a long time are vital. And what we saw in the New River Valley, and I know we're not unique in this, is that the pandemic really just shone a spotlight on where the cracks in our systems were and who needed more resources. And at the end of the day, it was the teachers, it was the healthcare, it was our mental health support services. Those are the folks who we are depending on. And I hear you say, I can preach real long, so I'm trying to put it all together real quick. I hear you say that there are partisan issues or whatever, but what's true is that trauma and resilience are nonpartisan. They are things that we all agree on. I have the ampersand tattooed on my hand to remind me to go back to what it is we all agree on. Yes. And we all agree that trauma happens and that resilience is possible. Right. And that our children and our educators and our healthcare workers and our mental health professionals are what keep us together and they're who show up. And so what I would want the transition packet to include, and what I would want the next administration to recognize, is that real work has been done on filling in these cracks and these gaps. And we can all agree on that. It does not matter what letter is beside your name. We can agree that our children spend a huge amount of time with our educators. And as far as resilience goes, this idea of getting trauma-informed schools is fantastic. During the pandemic, my kindergartner learned the downward dog. And I'm going to tell you right now, she did not learn it from me. She learned it from her trauma-informed school, and she learned when to use it. Yeah. And my second grader learned how to handle his anxiety with fidgets and with quiet spaces. He didn't learn that mess from me. I'm still paying money to learn those things. He learned it from his trauma-informed school. Yes. That shouldn't be the blue ribbon. It should be the standard, right? Imagine if we prepared our next workforce to be able to go to the bathroom and do the downward dog or whatever, instead of lashing out on the assembly line, or instead of lashing. If we could prepare all of our students in all of our schools with the resilience that some of these schools are providing, let's make that standard instead of, I love the blue ribbon. I'm not trying to yes, do that, but to the end of it's in all of our schools. It's where we all start.
And I want to give the last minute to Roanoke Valley.
Sorry, Roanoke.
Just to give you an opportunity, just real quickly. Just what needs have emerged and what would you like the next administration to know?
So we agree with everything that everybody else has said. The only other thing that kind of stands out for us, and that all of us on this call from our organization have had a lot of discussions about, is that trauma-informed care is not consistent across organizations. So let's say, for instance, we have a family that we're servicing through a CSB. We feel like we're really trauma-informed and supportive of that family, and then we send them to other governmental agencies, and they do not get that same level of care, which can be re-traumatizing for a lot of our kids. Unfortunately, a lot of organizations are kind of shame-based or punitive-based, and so we do a lot of work within a lot of our mental health organizations, but then when they are siphoned to other organizations within our valley or other governmental organizations, they don't have that. So it's kind of like whiplash for a lot of our families. And so what we would really hope and what we would really like to see is if there's a legislative mandate for state agencies to become trauma-informed, so that they don't have that whiplash when they're going from agency to agency.
Oh, thank you so much. Thank you all so much for your time today. Mrs. Northam, thank you so much for creating this opportunity and being so incredibly supportive of all of the work that we're doing here and having trauma-informed care the priority area of the Children's Cabinet. It's been amazing. But I'd like to give you the last word.
Oh, thank you. Oh my goodness, give a teacher a microphone. Well, we thank you all so very much. all this is so informative and so inspiring and so helpful. And we look forward to taking all this back to Richmond with us. And I so appreciate the comments about caring for those who care for us. It's so important now more than ever. We're so grateful for you. I think together, working together, we are a powerful force for good. And as you said so eloquently, you know, these are seismic times, but sometimes that seismic activity can open a crevice where we can reach in and do some really transformative work. And I think this is our moment to come together and do that kind of work for our children and for our future. You know, we won't rest until every child has good nutrition, adequate housing, until every child has medical care, excellent education, clean air and water, you know, the laughter of a loving family, and a supportive, economically thriving community. So thank you all so very much for each and every one of you and the part you play in that. And we're so grateful to you. And please keep using your voices. As David said, we'll work on our side, but we need you to tell your poignant stories as well. So let's keep fighting together for what we all believe and agree is important. Thank you all, and stay safe. Be well.